guys, welcome to my channel, The Ready Nurse Day. Today's video is going to be about working while in nursing school. Can you work while in nursing school? So if it's something you're interested in, just keep watching. So if you do not know, I would say go ahead and like, comment, and subscribe on this video. Go ahead and follow me on Instagram. My IG is Nay, N-A-Y _ The Ready Nurse Nay. And I post just different things going on in school, just to keep everybody updated and informed on what's going on. So, can you work while in nursing school? So, a little background about me. I am a BSN, Bachelor's of Science nursing student. I'm also a wife, a mom, and I work as well. So, you hear the question, can you work while in nursing school? Yes, you can. I will inform you, it is not easy. It's actually kind of quite difficult to balance the load of working and the load that that you have when you're in nursing school. The school part is a lot, but it can be done. Most schools will not recommend that you work because the amount of information that you are learning while in school is so intense that it is almost like having a full-time or part-time job. So it can be a lot. In nursing school, they're teaching you how to take care of a human being. So it is a lot of information that you're learning in a short amount of time. So if you don't have to work, like if you are financially set and stable to where you do not have to work, then I would say don't if you don't have to. But everybody is not in that predicament. Some people have to work. Like for me personally, I have to work. My family, we have my health insurance and my job, all of my benefits and things like that. My husband and I use both of our incomes to pay for our bills. So I kind of have to work. And we also pay for my schooling out of pocket. So I kind of have to work. It just is a necessity for me and my family at this time. And you might be in that same predicament, and it is possible. So I'm gonna give you a few tips on how to work while you're in nursing school. And then at the end, I'll kind of give you a little update of how it is personally for me working while in nursing school with all the other things that I have to do. So I have my little notes right here I'm gonna be looking at. Okay, so first thing, working while in nursing school tips. I have 5 tips. And then at the end, I'm gonna give you my little personal story. The first one is you need job flexibility. You need a job that is going to be flexible with you. For nursing school, you're going to be in nursing school honestly 20 hours a week is going to be dedicated to nursing school. So you need to have a job that is going to be able to accommodate your nursing school schedule. And sometimes you're going to have pop-up quizzes and pop-up lab days and stuff that you have to be on school on campus to practice things randomly. They change the schedule like that sometimes in school. So you have to have a job that is able to be flexible and accommodate your needs as a nursing student, because if you're going to school, you're paying all this money, you're putting all this time in, your nursing school is a priority. So you need to have a job that will be able to understand that and work with you. And I thank God, and I'm blessed that my job, they work with me. They're awesome. The second one is try to get a job that is low stress. I'm not gonna lie, nursing school is super stressful. It's already the 3rd week that I've been in my clinical program, and I am exhausted. I'm exhausted. And you're gonna be tired. You're gonna be tired while you're in school, while you're in nursing school, and it just is. So if you can get a job that is kind of like low stress type of thing, where you can possibly work at home or just work on the weekends or the evenings to bring in some extra cash, make extra money, then that is going to be perfect for you. Also, the 3rd tip is something that will accommodate your needs. So everybody's needs when they're working jobs is going to be different. Some people are going to be working jobs because they need reasonable pay for their bills. Some people are going to be working jobs because they need benefits and things like that. Some people are going to be working jobs for the extra money, whatever it is. Whatever your reason is for working, like I work because I need to pay my bills, then you need to get something that will accommodate that. So maybe you might have to, you might need a job making a certain range to accommodate your bills, or you need to work so many hours to be able to pay your bills. Then you kind of need to get something that will accommodate whatever your needs are. Hopefully that makes sense. Okay. The next one is hospital experience. A lot of people are big on like, oh, I need this hospital experience. That's great, for the experience, but let me let you in a little secret. They're not paying the nurse techs a bunch of money. They're not. You're student nurses, so you're not making like nurse pay. You're not being paid a bunch of money. So if you can work in a hospital or in a clinical setting as a tech, I think it's worth it for the experience. I did that. I did that for about a year, and the experience that I gained was priceless. I was able to, when I worked as a tech, follow the nurses around and be able to, see healthcare professionals in their environment. I was able to assist with a lot of things, participate. You get very comfortable in the clinical setting with patients and stuff. So hospital experience or any type of healthcare experience is great. If you can work as a tech, I would say go for it. Do it. Even if you do it as a short period of time, 6 months to a year, whatever, you get so much good experience. But at the same time, know that nurse techs do not make a bunch of money. And for the most part, you're not really doing it for the money. It's really like the experience, and you get paid with it, which is pretty cool. It's cool. But if sometimes you might need to work something different to make a little bit more if you have to make ends meet. So that's just kind of something to keep in mind. But it is awesome experience. My fifth tip that I have really is just to do what is best for you. Everybody's situation is different, guys. Like you can't compare your situation to somebody else's. Everybody's situation is different. Like for me personally, I'm a wife, I'm a mom, I work, I'm an employee. I have a previous degree. I have a bachelor's degree in psychology. I have work experience and work history, working in different fields and things like that. So me coming back from my bachelor's of nursing degree is kind of like almost like a second, like a career change or something. So it, my lifestyle, I already have like my, things set in my life, as far as, having a home and car and all these bills and stuff. I already have those things set. So my life and what I need to, do what is best for me is different from someone who maybe is a fresh new high school student, living on campus, getting their degree in nursing, they don't have kids, don't have bills, whatever. It's different. My life is different. So I can't compare my life to what they're doing and they can't compare theirs to what I'm doing, because what we need and what is best for them may not be what is best for me, and what is best for me is not what is best for them. So you kind of have to do what is best for you. So if you have to work, just buckle down, find something that is flexible, low stress, will accommodate your needs. If you can get some type of direct patient care experience, that's awesome. But if not, just work the job you got to work so that you can, pay your bills. So yeah, just do what is best for you. Don't compare. Everybody's story is going to look different. Everybody's nursing journey, if you're a nurse, it's going to look different. If you are a college student, whatever that is, it's just going to look different. Your journey is going to be different. So you can't really compare the two. You got to do what's best for you. My last little minute of this video, I'll talk about my update of how it's going for me. Like I said, I'm in the 3rd week of nursing school, of nursing clinicals. And yeah, I'm exhausted. I'm tired. I am tired. I'm not gonna lie. I prep on the weekends. Prep myself for the weekend, on the weekend, for what I have to do for the week. And then the week hits and it's like, boom. It's like I have class, and then I leave class and I go to work. And then I have class next day, and then I have work. And then I see myself, I'm waking up sometimes at 5 in the morning to complete work assignments. Waking up at 5 in the morning, working on, class assignments and things like that. Trying to find the balance between spending time, with my toddler, and having mommy and me time with my toddler, and then spending wife time with my husband. So we're spending our time together or whatever. So yeah, I'm pretty exhausted. And then what happens, I think, with when you have all those things combined, the switch up is exhausting. You know, you're constantly switching up. And nursing school is it's just so all encompassing. Like, it's like you're thinking about it all the time when you're in school. You're thinking about it all the time, and it's so all consuming, you know. So it can be a lot, and it's only 3 weeks, but you know, so I'm just kind of giving you a heads up, but it can be a lot. And the switch up of switching from school, I'm in school mode learning, and then I'm like, gotta switch. Now I'm at work mode and I'm working. Switch. Now I'm in mommy mode and I'm, you know, playing with my toddler. Switch. Now I'm in wife mode and you know, spend time with my husband or whatever. Switch. You know, doing chores in the house and switching back in these different modes is very exhausting. So you know, if you are considering working while in nursing school, or asking the question is if it's possible, it is very possible. I'm doing it, and there are so many other people that are in my class, you know, who are parents, you know, spouses, you know, who have bills they have to pay for, you know, or maybe they're working because they want some extra cash, whatever the whatever, you know, their need is or whatever. But it's possible, but it is definitely tiring. I'm not even gonna lie, it's tiring. And but it's doable, and you kind of just got to do what you got to do. Nursing school is temporary. I'll be finished in these 2.5 years, and I'm gonna be a registered nurse. So I'm just gonna buckle down and do what I got to do, and I'm thanking God, hallelujah, that I'm able to do all this stuff, be able to work and go to school, and you know, be a mom and be a wife, and have my family supporting me and coming along the way. So I hope this was encouraging to you guys. I hope this gave you some insight. And yeah, guys, be blessed. I would say go ahead, like, comment, and subscribe, and also follow me on Instagram. My Instagram is Nay, Nay _ the Ready Nurse Nay. It's kind of long, but that's all I could come up with. So that's the name on Instagram, and I'll be posting kind of updates about the journey and things like that. So like this video, give it a thumbs up, and I'll see you in the next video. Bye.